Well, I'm almost off. I am officially at 12:15, so um, I will think about getting the show on the road. Cassie, do me a big favor before I get started. Can you confirm or look that it was set for 12:15 and not 12:30? Because this happened one other time. We had lots of people scheduled to attend, and then they started jumping on like 10 minutes from now. So I just want to make sure. But I'm happy to talk to Lori.
Yeah, give me just a second.
No problem. Lori, I'll go ahead and start since you are here. I don't want to waste your time, but I notice you are internal. You're a U of L person. So I want to make sure I can customize and make sure I can give you the appropriate information that you need as well. So I think I am sharing my screen. So we're going to talk about the Health Professions Education Master's and Certificate Program that we have here at the School of Medicine at U of L. And so I always like to kind of start off with our goals. What are the goals of the program? Um, Pretty simple. I want to develop educational leaders, and that is key. I also want to provide our academic institutions with what we would consider highly qualified educators. So people who know how to teach, how learning works, how to get new knowledge to others, and then to serve the discipline. This is a great place for research and scholarship as well. So those are my big overarching goals with the HPE program. Then we have some competencies. It's always important to have identified, thank you, what it is you want someone to know or be able to do by the time they finish. And so this is pretty simple. I have a competency around, I want you to be able to create learning opportunities. That is, I want those informed by relevant theory, learning science, and be able to do that in both a clinical learning environment as well as a didactic or lecture or small group, other types of learning environments, because the clinical learning environment versus a classroom learning environment are completely different. Um, and then our second competency is really around the ability to assess and evaluate. Um, we assess and evaluate research all the time, but when we're looking at the literature in HPE, health professions education, it's really can be a little different than what bench science or clinical trials can be. And so uh, I really want you to be able to access the literature and evaluate it and be able to use it in your work. Our third competency is around develop and promote an educator identity. Lots of folks around here have spent a long time developing their professional identity as a dentist or a physician or a nurse or any number of different types of professionals. They haven't spent a lot of time thinking about themselves as a professional educator. And so that is one of the competencies I hope to help people is to develop that part of their identity because they are working in higher ed and I want them to see themselves as a professional educator or a professional medical educator, nursing educator. Our fourth competency is around utilizing evidence-based learning strategies. I want you to be able to engage all your learners, not just the ones who are on the edge of their seat, listening to every word you say, but how do we engage all learners? We want to be able to, create these supportive learning environments. And that really does come down to creating an environment of psychological safety and lots of other issues that pile into that as well. But that's a big bucket to unpack. Our fifth competency, I want you to have some scholarly skills. Like I said, it's completely different, the research aspect than what it may be in clinical trials or bench science. Educational research has a different lens. And I not only do I want you to develop some scholarly skills, I also want you to be able to utilize the literature to kind of influence what you're doing. And then the last competency is around leadership. Like I said, in one of my goals is to create educational leaders. And so I really need folks who can influence their educational environment and be able to communicate effectively across large swaths of the institution, whether we're just talking the School of Medicine as a whole, or the Health Science Center, or the entire university. So those are the 6 competencies. And what is special about our program? People are always curious. We do have clinicians with education degrees. I sought them out. They're not easy to find. And all our courses, I will make a caveat, almost all our courses are 8-week asynchronous classes, which are very helpful for our busy faculty and staff who work on the Health Sciences Center. There are a couple of courses that are not 8 weeks, and I will talk about those in a few minutes. And then the concentration of our program is really around teaching, and I want to make sure that folks understand the research aspect is important, but I really want to come away with high quality educators, folks that can truly impact our next generation of providers and be able to support folks along their educational journeys. So that is key. So, like I said, we have 2 programs. We have a graduate certificate, and that is 4 courses. They're 3 credit hours each. So for a total of 12 credit hours. I'm going to kind of walk through those 4 courses. We have HPE 650, which is evaluation and assessment. This is your introduction to, you know, some literature, really. How do we evaluate and how do we assess? How do we know learning occurred other than providing a multiple choice assessment? So there's lots to look at and lots to dig into with evaluation and assessment. 665 is teaching and learning. I would change the name of this course in a heartbeat to Introduction to Teaching or something like that, Introduction to Learning Science, but it's teaching and learning. We spend a great deal of time looking at what cognitive science has done over the past 20, 30 years and how that has impacted teaching, how it impacts learning, and how a lot of our learners don't have that background knowledge. It's not something they're coming to college with, and they don't know how to study and they don't know what best practices are. And so we spend a lot of time looking at misconceptions and trying to help people see what's really going on as far as learning is concerned. 675 is program development. This course is really around creating a new program or a new course or creating some type of educational program. It could be a residency, updating a residency program. It could be a new fellowship program. It could lots of different things. But there are evidence-based processes that we want to introduce you to in this course to help you be able to create any type of educational intervention that you want. And so this really you can use these foundational knowledge and skills to create anything from a grand rounds presentation all the way to, a multi-year program. So that's what 675 is about. And then 676 is instructional strategies. This is the 1,001 ways to teach something. It's important to know there are lots of different methods to teach content, but not only do you need to keep in mind what the content is that you're teaching, but you also need to keep in mind what the environment is. Is it a small group? Is it a lecture hall? Is it in the clinical learning environment? Um, Certain strategies work well at different places, and certain strategies work well with different types of information. And it's also important to have additional instructional strategies in your back pocket, because some instructional strategies just might not work for a particular learner, and you can pull something out of your toolbox and say, here, why don't you try it this way, and see if we can help them grasp the new information a little easier. So those four courses actually do transfer directly into the master's degree. But if you just stop here, that would give you the graduate certificate. But for the master's degree, it is a 33 credit hour non-thesis degree. I do believe I talked about how all our courses are 8 weeks, but not the professional project. The professional project is generally the last course that you take in the program, and it is a full 16-week semester because it takes a lot of work to be able to get a project off the ground. Um, and I also like to reinforce all our courses are HPE specific. This is not a program where you're taking just the core courses that are connected to health professions and then taking a bunch of College of Education classes. All of them have been developed here in the School of Medicine and are health professions specific. So, what are the courses in the master's? There are those four courses we just talked about. So, teaching and learning, program development, um, instructional strategies, evaluation and assessment. So those four, plus the following. We have an educational leadership course, which is incredibly important to understand how to lead in educational settings. Evidence-based practice. This will be one of the only places where you'll really learn about the research aspect of HPE. I'm not saying you won't do any research, but like I said, the focus of our program is on the teaching aspect. And so, but we want to give you a little bit of taste, a taste of it, so to speak. Then the professional project is also part of the required components. So since it's 33 credit hours, 4 plus 3 there, we're not quite at the total. So we have electives. So you would take the 4 certificate courses, those 3 courses, and then you have an option of 4 electives. We have lots of different electives, but I'll just throw up some of them. We've got a simulation, well-being. I don't know why they pop in weird order. Well-being is like, how are you taking, we all know this is a high stress environment. And not only do we need to be taking care of ourselves, but we need to be taking care of our learners as well. And so that's what the well-being course is about. We also have an entire course on feedback. Feedback is so hard. How do you give feedback to your learners and trainees where they will accept the feedback and use that feedback to make changes? Sometimes, learners can be very defensive, or, it's just a very tight rope to walk when we're providing critical feedback to others. And so this course will help with that process. We have an entire course on interprofessional education. IP is how we work, right? We're always working with lots of different professionals. And so understanding what other professionals are bringing to the table, I think is important. I have a qualitative data class. Educational research a lot of times utilizes qualitative methods. as well as quantitative, but qualitative data analysis is a little different. And so we went ahead and put together an entire course on qualitative data analysis because so many folks were wanting to start some HPE research and felt that that would be helpful for them. And we have a couple more. But that gives you a pretty good gist of the types of courses that we have as electives. A lot of people, it's like, well, what do I do if I want to start? Um, you have to apply to the graduate school. Um, I can't get you out of that one. Um, you have to create the graduate application or complete the graduate application and provide one letter of recommendation, a personal statement. The personal statement doesn't have to be thousands of pages. It can be, a few paragraphs explaining why you want to do this and what you hope to get out of it or what you want to do with these knowledge and skills. The application fee, can't get you out of that one either. The graduate school has to collect some money somehow. And then all official transcripts are also required. But if you're faculty in the School of Medicine, we do have a way of getting with Faculty Affairs to see if your official transcripts are on file. If they are, you'll be okay. If they're not on file, during your initial hiring process, then you will have to go back and get official transcripts from all the institutions that you have attended. So deadlines, spring 20, or like I said, we have 8-week courses. And so that gives us the opportunity to have multiple start dates. So for instance, we're in spring 26 right now. The semester just started in July 7th, I believe. And so we also have spring 2. So spring 1 is the first 8 weeks. Spring 2 is the second 8 weeks. So the start date of spring 2 is February 26th. Man, it goes by fast. You can start in the summer. Summer start date is late May 27th. And then, of course, you could start in fall 1 or fall 2. The certificate, though, we do not offer any of the certificate courses during this summer. Those are only offered during the fall and spring semesters. But most people, if they want to do the certificate, there are 2 courses offered in the fall and 2 courses offered in the spring, and they generally can get everything finished in a calendar year, or less. So it's really, you would take one in fall 1, one in fall 2, one course in spring 1, one course in spring 2, and that would be it. So other key information that you may want to know, and this is not going to apply. So folks who are internal, you have tuition remission. So just like to make that, make you aware of that. So tuition remission will pay for, I think, up to 8 credit hours per semester. And so since all our courses are 3 credit hours each, it will pay for 2 courses a semester. And that does work for spring, summer, and fall. So all 3 semesters over the course of a calendar year, you can take 2 courses each semester. If you were working on the master's degree, it really takes about 2 years and a semester to finish the entire master's. And then, of course, I always like to remind folks that that capstone course is a full 16-week course that you would take during your hopefully last semester. Sometimes, depending on schedules, sometimes people have to take it the semester just prior to the last semester. So things move around. And we understand that. Here's information where you can contact me if you have questions or want additional information. Jamise Harris is our admissions specialist, and she can answer questions on how to apply and the process of getting through the graduate application. So much fun. And I just like to open it up for any questions you may have. Looks like I've gone very speedy today. That's okay. Yeah, hi.
Hi, thank you for your all's time today. I appreciate it.
Sure.
Question is for if I were to begin, if I decide to do the certificate,
Mhm.
when does it begin in fall?
Uh, when fall one will be whenever the semester starts in August. I can look that up for you real quick. Um, so for can hop over to the U of L website, ask for the calendar, and it will show us. Let's see. Search academic calendar. And we go to the academic calendar, and I'm going to move this over here so you could see. So it would be undergraduate programs. It's not the medical school. So we're in the medical school, but we follow the graduate calendar. And let me scroll down. So, wow, they don't have fall 26 up yet, but generally we start classes. Well, you can see a year ago, or well, 6 months ago, we started August 18th. Um, and so if we wanted to look at the first half of the fall, it started on August 18th and then finished the last day of classes for the first 8-week course was finished up around October 8th. And then the second half of the semester started October 9 and finished up at the end of the semester in early December. So those are and you can go to the U of L website and I just type in academic calendar and I get right here to this page. So you can see that information.
Okay, I appreciate that.
Hey,
My
no problem.
more concern with I will be in Boston
Ah,
August I think it's the 9th through the 16th, maybe. So that's what I was curious to see because I don't want
ah,
to miss the start, and
ah.
that's what I
Well,
wanted.
yeah, our courses are asynchronous, so which means you wouldn't miss this as long as you have internet access, you will be just fine. And we actually try to open up our courses 1 or 2 weeks ahead of time, because a lot of times we're catering to busy clinicians and sometimes they're on service for a whole week, stretch. And so we like to get stuff out to them early so that they can plan around their schedules. So
Right. No, I understand. I used to work for another university where I was the clinical, excuse me, the didactic and the clinical assistant with setting up rotations and all of that. So
oh yeah.
I understand that. But so as far as my transcripts,
Yes.
I would definitely need to get those. I have two masters and two bachelors.
Okay.
Mm, So I
And
went around with
and
the
you
PhD, but I have not.
gotten there yet?
Oh, yeah.
I get it.
I feel like I got
Uh,
for two, so I would have to get two. So,
I
but
understand. Um, so I guess, okay, so you're not a faculty, so a staff, then yeah, you would have to get all your transcripts. Jamise, who couldn't be on the call today, Kimberly Moore is with us and she's helps with our HPE program. But Jamise can tell you exactly how to get transcripts from other institutions. Like they use different electronic services. Some institutions use one service, some institutions use the other service. She has a list of what
right,
institution is on which service, and it's apparently not too hard. You just kind of go in there, and as long as you have some identifying information from when you were a student there, that you can access your information, and then it will send the official transcript directly to the graduate school, and you won't even see it.
okay. Great. Thank you. I appreciate your time, Stacy.
No problem. And I can have Jamise reach out to you if you would like, where she can get you that information. In addition, we always get questions about, how much work is it really? And, that sort of thing. We have some podcasts where we have talked to HPE graduates. And so we'll probably send you a link to one or two of those. And that way you can listen to those
That's a
folks that have,
resource.
have yeah, they're it's very helpful. People love them. And so we will get you some links so you can hear what folks have to say. So I think
That's
that's very
good.
useful.
Yeah, my thing is if you're signing up regardless.
Yeah,
So, I mean, you just got to do what you have to do.
I
But
know, I know.
you need to have that additional resource to hear people's, testimonies. So,
Really? No, you're absolutely right. And then, of course, I'm always happy to, find somebody currently in the program if you want to talk to somebody. I'm happy to put you in contact with someone if you would like to, a recent grad or somebody who's in the certificate program right now. Happy to make a connection for you. Oh, look,
oh,
Kim
thank
put
you.
a
I appreciate that.
we try to be helpful.
Thank you, thank you. Well, I think what I'm going to do is also look further into the courses, just because I want to get
Yes.
more information on those. Um, but I think that's it. If I have any questions, I would definitely reach out to you all. So I appreciate your all's time and putting this together. I'm sorry I was the only one. Maybe there'll be
It's
more later
okay.
day.
It changes if it really does fluctuate. Sometimes I have a giant list and, one person shows up. Sometimes I have like hardly anybody on a list and I have like 12. I was like, whoa, what happened? So you
Understand.
never know.
Understand. All right. Well, thank you all. I appreciate it.
All right. Take care.
Have a good day.
Bye-bye.
Bye bye.